Hello everyone, today we'll be looking at the examination of the knee. This is REMS of the knee. REMS stands for Regional Examination of the Musculoskeletal System. To get this copy of this document, you can go to Google and search Arthritis Research UK, Examination of the Musculoskeletal System, and you should be able to download a copy of this for yourself. So I'm going to go through what's written here first, and then I'm going to try to summarize so that's easier to remember. If you want to skip to the summary, you can I'll provide a link in the description to the timeline. Okay, without further ado, let's start. Examination of the knee. Look. So for every REMS, you do look, feel, move, functional tests. Look first. From the end of the couch and with the patient's legs straight, observe the knees comparing one with the other for symmetry and alignment. So observe the knees for symmetry and alignment. Is the posture of the knee normal? Look for valgus deformity. Where the leg below the knee is deviated laterally, not head. And for varus deformity, where the leg below the knee is deviated medially, bow-legged. Okay, check for the knee flexion deformity, distinguishing this from hip flexion deformity by examining hip movements. Knee flexion deformity. How do you check? It doesn't say here how do you check. Oh, this just looks, so you're observing. You're just observing. From the end of the couch. This doesn't make sense because when you want to look for valgus or varus deformity of the knee, it is better to observe it when the patient is standing. When the patient is lying on the bed, it's not that easy to look for these deformities. So I would do this when the patient is standing. And I'm not sure how you check for knee flexion deformity. We'll just move on. Check for muscle wasting or scars. Okay, look for redness suggesting inflammation or infection. Look for obvious swelling. Check for a rash suggesting psoriasis. Okay, so just looking for anything that you can find, any swelling, any redness, any rash, any deformities. Right. Next comes feel. Oh, there's a note here. Popliteal swellings, varus and valgus deformities may be more apparent with the patient weight bearing. Yeah, this is what I mentioned just now. So it's better to do it when the patient is standing up. These things. Okay, moving on to feel. Look, feel, move, function test. Feel. Using the back of your hand, feel the skin temperature starting with the mid-thigh and comparing it to the temperature over the knee. Compare one knee to the other. Okay, palpate for tenderness along the borders of the patella. With the knee flexed to 90 degrees, palpate for tenderness and swelling along the joint line from the femoral condyles to the inferior pole of the patella, then down the inferior patellar tendon to the tibial tuberosity. Joint line from the femoral condyles. Femoral condyles are up here to the inferior pole of the patella, then down the inferior patellar tendon to the tibial tuberosity. Okay, feel behind the knee for a popliteal cyst. Behind the knee. Assess for an effusion by performing a patellar tap as described for the screening examination. Yeah, if you're not sure what this is about, go watch the video on gauss. It's explained over there. If there is no obvious patellar tap, assess for a fluid bulge by cross fluctuation. Stroke the medial side of the knee to upwards towards the suprapatellar pouch to empty the medial compartment of fluid, then stroke the lateral side downwards distally. The medial side may refill and produce a bulge of fluid indicating an effusion. Okay, we're done look feel. Now we're going to move. Ask the patient to flex the knee as far as possible to assess active movement, making sure the patient is fully relaxed. Assess passive movement. So first you ask them to do it themselves, then you do it passively. This is done by placing one hand on the knee, feeling for crepitus, and feeling the knee as far and flexing the knee as far as possible, noting the range of movement. Assess full flexion and extension of the knees, comparing one to the other. Next, with the knee flexed to 90 degrees, check the stability of the knee ligaments. Look initially from the side of the knee, checking for a posterior sag or step back of the tibia, suggesting posterior cruciate ligament damage. Perform an anterior draw test. Place both hands round the upper tibia with your thumbs over the tibial tuberosity and index fingers tucked under the hamstrings to make sure these are relaxed. Stabilize the lower tibia with your forearm and gently pull the upper tibia forward. It's shown here. In a relaxed normal patient, there is normally a small degree of movement, more significant movements such as anterior cruciate ligament laxity. Assess medial and lateral collateral ligament stability by flexing the knee to 15 degrees and alternately stressing the joint line on each side. Place one hand on the opposite side of the joint line to that which you are testing and apply force to the lower tibia. This may be done with the leg on the couch or with the lower tibia supported on the examiner's pelvis. I think it's shown somewhere here. Yep, it's shown over here. And lastly, functional tests. Functions of the knees. You just ask the patient to stand and then walk a few steps, looking again for a varus or valgus deformity. Simple. Okay. Let's try and summarize. Oh, this is examination of the hip already. Okay, examination of the knee. First, you look. It says here from the end of the couch with the patient's legs straight. So it's implying that the patient is on the couch right now. One of the principles that you can follow while doing REMS is that you do everything that can be done while the patient is weight bearing first before you ask them to go to the couch. So how I would modify this is you can do the functional test first, because the functional test is just asking the patient to walk a few steps. It's some sort like GALS, where you start with gait, because gait can tell you a lot of things. In this case, you start with functional tests, because you need to do it when the patient is standing. So you can ask them to walk a few steps and then ask them to turn back and walk back. And you ask them to stand still, and then you can check for valgus and varus deformity. These are much easier to assess when the patient is standing, the patient is weight bearing. same thing. Okay, so you ask the patient to walk to the end and turn around and come back. You observe the gait at the same time. You are thinking of functional test of the knee. And then when he comes back, ask him or her to stand still, and you observe the legs to see if there's any valgus or varus deformity. An easy way to remember the difference between valgus and varus is that valgus, V-A-L-G-U-S, G. The G in valgus stands for gum or glue. So when I think of valgus and varus, I think of the knee, and then valgus is when the knees are glued together. So the angle is like this, and in varus deformity, it will be the opposite. Little tip here. Okay, so when he's standing, you can look for all these other things as well. Knee flexion deformity, muscle wasting or scars, look for redness and inflammation, look for obvious swelling, and then you can ask them to go to the couch and you can look from the end of the couch. Okay, so that's look and function test covered. Now we move on to feel. So you feel for temperature first. Compare between the mid-thigh and the knee. Usually the mid-thigh will be warmer than the knee, but if there's inflammation of the knee, it might be hot to touch on the knee. Compare one knee to the other. So temperature, then palpate for tenderness along the borders of the patella. So around the borders of the patella like this. And then with the knee flexed to 90 degrees, palpate for tenderness and swelling along the joint line from the femoral condyles. So you ask them to bend the knees to 90 degrees, and then you palpate the joint line and down around the patella and down the down the tibial tuberosity. So first is temperature, then tenderness when the leg is straight, then tenderness when the leg is flexed, when the knee is flexed 90 degrees, and then feel for a Baker's cyst. And straighten the leg again, assess for an effusion. The sequence is not very nice here. You're asking the patient to bend the leg and then straightening the leg again to check for patellar tap. What I would modify here is in feel, you're gonna start with feeling for skin temperature, and then you do the patellar tap and the fluid cross fluctuation first. Okay, so feel temperature, do patellar tap, do cross fluctuation, then feel for tenderness along the patella borders, and then flex the knee to 90 degrees and feel along the femoral condyles, down the patellar border, down to the tibial tuberosity. Okay, that's a much better way. Alright, now we move on to move. So in move, you're not gonna touch the patient first because you're gonna assess active movement, which means the patient does the movements on his own using his own muscles. So just look from the side. Ask them to flex their knee as far as possible, which means they have to bring their heel to their buttocks. That's the furthest you can flex your knee, and then extend it again, and then do it for them passively, feeling for crepitations. Now you flex the knee to 90 degrees, and then you're gonna look from the side to check if there's any posterior sagging. There's a mix of look in the move here. So, okay. Check for posterior sag and then do an anterior draw test. And where's the posterior draw test? I guess it's not listed here, but you can do it as well. Instead of pulling forward, you push backwards to check for posterior draw test. This is to check for posterior cruciate ligament damage. It's the same reason you do you look for posterior sag. Okay. Next, you assess the medial and lateral collateral ligament. So, first, flexion and extension of the knee, active and passive, and then look for posterior sag and do anterior draw, and you can add in posterior draw. Assess medial and lateral collateral ligament. Easy. Move the knee, flex to 90, look, pull in front, push back, and pull from side to side with the knee flexed to 15 degrees. Okay. Function, we have done. So I guess that's all. I'm going to try to summarize it again more simply. So first, we do this is an exception in all the REMS. You do look feel move function tests. In this case, it's more intuitive to do function tests first. So ask them to walk from where you are to a distance away, turn back and walk back. You observe for the gait, and then ask them to stand straight, and you're gonna observe for valgus and varus deformity, and then you're gonna ask them to lie on the couch and observe for any asymmetry, any redness, swelling, deformities they can find, and any rash. Okay, when they're standing, remember to look behind their legs for popliteal swellings, because when they're lying down, the popliteal area is gonna be covered. So when standing, you look for popliteal swellings, varus and valgus deformity, and then when lying down, you look for all the other things. And feel. Now you're gonna feel for temperature, and then you're gonna do the Patellar tap, and then the cross fluctuation. Do Patellar tap, and okay, do feel for temperature, then Patellar tap and cross fluctuation, and then palpate for tenderness when the leg is straight, when the knee is straight, and then flex the knee to 90 degrees, palpate again for tenderness, and then feel for popliteal cyst behind the knee. And I think that's all. So temperature, tenderness, temperature, Patellar tap, effusion, cross fluctuation, and then tenderness when the leg is straight, tenderness when the leg is 90 degrees, and then popliteal cyst. Next, move. Flex and extend, active first, and then passive, and then check for posterior sag, do anterior draw and possibly posterior draw, and then assess medial and lateral collateral ligament. That's all for your REMS of the knee. So walk first. This last summary, I hope. Walk to the end, come back, and then observe for valgus and varus and popliteal swelling, and ask them to lie on the couch. And then you look for the other things, and then you feel for temperature. You check for Patellar tap, for cross fluctuation, and then palpate for tenderness over the borders of the patella, bend to 90 degrees, palpate for tenderness along the joint lines, and down to the tibial tuberosity, and then check for popliteal cyst. Did I miss anything? No. Okay. Then move, look, feel, move. Ask the patient to flex the knee. So flexion, extension of the knee, and then posterior sag, anterior draw, posterior draw, and median lateral collateral ligament stability. Okay, that's all I have for you. Thank you.